This medication is used to treat or prevent certain types of headaches, such as migraine headaches and cluster headaches. It works by narrowing widened blood vessels in the head, reducing the throbbing effects of vascular headaches. The caffeine in the medication also helps by narrowing the widened blood vessels in the head. The suppository form is used when medications cannot be taken by mouth, for example, due to nausea and vomiting. It is important to follow the recommended dosage and timing for best results. Insert one suppository rectally as directed by your doctor and remain lying down for a few minutes. Avoid having a bowel movement for an hour or longer so the drug will be absorbed properly. If the suppository becomes soft, chill it in ice-cold water before use. The dosage is based on your medical condition and response to treatment. This medication works best if it is used at the first signs of a headache. It should only be used as needed and not for long-term daily use. The maximum dose is 2 suppositories for a single headache attack and 5 suppositories in any 7-day period. If you suddenly stop using this medication, you may have withdrawal symptoms. Your doctor may lower your dose slowly to prevent withdrawal. Using this medication for migraine attacks on 10 or more days each month may actually make your headaches worse. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Some common side effects of Migergot Suppository, Rectal may include nausea, vomiting, restlessness, trouble sleeping, and dizziness. If these effects persist or worsen, it is important to contact your doctor or pharmacist. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, in the event of any serious side effects such as rectal pain/bleeding, irregular heartbeat, tingling/pain/coldness in the fingers/toes, or signs of kidney problems, it is important to contact your doctor immediately. In rare cases, a serious allergic reaction may occur. If you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. As for the optimal timing and dosage, it is best to follow your doctor's instructions. If you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider. This medication can rarely cause a serious lack of blood flow to the hands and feet or to the brain, which could lead to a stroke. The risk of this happening is increased when taking Migergot Suppository, Rectal with other drugs that can affect the removal of ergotamine from your body. Such drugs include azole antifungals, cobicistat, mifepristone, certain antidepressants, macrolide antibiotics, HIV protease inhibitors, and SSRIs, among others. Be sure to talk to your doctor about any concerns you may have about taking this medication. Before using Migergot Suppository, Rectal, it's important to discuss any allergies you may have with your doctor or pharmacist, as well as any medical history of conditions such as high blood pressure, liver or kidney disease, and diabetes. This medication can cause dizziness, so it's important to avoid alcohol and marijuana while using it. Driving or operating machinery should also be avoided until you are sure you can do so safely. Using tobacco or nicotine products while taking this medication can increase the risk of serious side effects, so it's best to avoid them. If you smoke, talk to your doctor about how to stop. It's important to inform your doctor if you are planning to have surgery or medical procedures while using this medication, as well as if you are pregnant or breastfeeding. Overall, Migergot Suppository, Rectal should be used with caution and under the guidance of a healthcare professional to ensure safety and effectiveness. It's important to be aware of potential interactions with other medications. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor first. If you are taking any triptan migraine drugs, it's important to separate your doses of triptan from your dose of Migergot Suppository, Rectal to reduce the risk of serious side effects. Ask your doctor how long you should wait between doses. Certain products may contain caffeine or ingredients that could affect your heart rate or blood pressure. It's important to inform your pharmacist about all the products you are using, especially cough and cold products, diet aids, or other headache products, and ask how to use them safely. This medication may also interfere with certain medical/lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If anyone swallows this medicine by accident, it can be harmful. If someone takes too much and experiences serious symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, reach out to a poison control center for assistance. In the United States, residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe dizziness or drowsiness, loss of feeling in the fingers or toes, rapid or weak heartbeat, and bluish hands or feet. This medicine should be used as directed, and it's important to never exceed the recommended dosage. Always consult with a healthcare professional to determine the best time to use this medication and the appropriate dosage for your specific situation. It's important not to share this medication with others. Certain foods and beverages, as well as food additives like red wine, cheese, chocolate, monosodium glutamate, and alcohol, can trigger migraine headaches. Some lifestyle patterns, such as irregular eating or sleeping habits and stress, may also bring about a migraine headache. Avoiding these triggers may help decrease the frequency of migraine headaches. It's best to consult your doctor for more details on how to manage your triggers. If you forget to use Migergot Suppository, Rectal, you can use it as soon as you remember. If it's almost time for your next dose, you can skip the missed dose and use the next one at your regular scheduled time. Do not take a double dose to make up for the missed one. It is important to store Migergot Suppository, Rectal in the refrigerator, but do not freeze it. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard this product and it is expired or no longer needed. For guidance on how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.